आज जागतिक भलायकी दीस. इंडियन मेडिकल असोसिएशनान ह्या वर्सा हो दीस मानसीक भलायकी विशीं जागृताय करपाचें थारायला. त्या निमतान गोमंतक टीव्ही कडेन उलयतना डॉक्टर हर्षवर्धन देवसेकर हांणी मानसीक भलायकीच्या म्हत्वा बद्दल म्हायती दिली.
In the year 2017, the then President of India, Mr. Ramnath Kovind, stated that our country was at the brink of a possible mental health epidemic. In the same year, National Mental Health Survey, the first of its kind pan-India mental health survey, was conducted, and its report stated that approximately 4.7% of the population of India suffered from mental health disease, and this number was up from 2.5% from 1990. With this study further to be conducted in the year 2024, we expect the disease burden to only rise. The COVID-19 epidemic of 2020 further brought mental health into the spotlight, with many of the youngsters facing mental health crisis. Mental health issues were back into the society. Gone are the days when the mental health and its associated diseases would only be an affliction of the wealthy and the privileged. Mental health disease burden spans a wide variety of the population and afflicts not only the privileged but also the downtrodden and the economically poor strata of the society. The same study reiterated that more than 13% of the Indian population would suffer some sort of mental health deterioration in their lifetime. This is a startling number. So how do we tackle this? To tackle any problem, the first way would be to address the problem itself. With 57 million Indians suffering from mental health disease every year, only 20% of this number would ever receive treatment, if at all any medical attention. The second issue faced is judgment and societal stigma from members of the society, family, friends, peers that would otherwise bring this condition to the limelight and result in early detection and treatment. What are the causes and how to recognize mental health diseases? The causes of mental health diseases are across the spectrum. It can be brought about genetically at the time of birth or during childhood when the person might face neglect or abuse by an adult or the parents, or it can be brought on later in life due to any particular stresses such as war, trauma, death of a loved or near one, a friend, or brought about by other diseases or systemic diseases such as cancer. So how do we treat mental health issues? The first step towards treatment would be to create safe spaces. These safe spaces are places for open discussion and recognition of symptoms, where a person suffering from mental health diseases or any person who is just feeling down the weather or who's feeling low can openly discuss his or her issues without the fear of judgment or stigma. These safe spaces can be created in our homes, in our schools or colleges, or even in the workplace. The second step to treatment of mental health disorders is to seek help. If you think a family member, a loved one, or a friend that you may know is suffering from mental health disorders, it's always wise to seek help if this person has not already sought help. Help from a trained therapist, a psychiatrist, or any medical professional can bring to attention any undiagnosed issues. Seeking help from these professionals can help reduce burden of this disease on your loved ones and can further improve their quality of life. So let's work together to break this shackle of mental health disease and to bring our loved ones and our family members closer to living their best potential and a happy and a healthy life.